Hi, I'm Dr. Merrilee Brown and welcome to Port Perry. Port Perry is a town of 10,000 people about an hour north and east of Toronto. Although we do actually have an area that goes an hour north and an hour east, as well as half an hour south and west. So it's quite a large catchment area here. There's about 60,000 people in our catchment area, and about 40,000 of those people come to our clinic. So it's a pretty big clinic. We're now up to 33 doctors, including 30 family doctors, 3 general surgeons, 1.5 general internists, as well as 6 GP anesthetists. So we've got a really broad scope of practice. All of us here do hospital work, so you will do hospital inpatient work. It's part of the requirements. And many of us do emergency room work. I do between 6 and 8 shifts a month, and that's usually what I schedule the resident with as well. I'm one of the palliative care physicians, so we do both an inpatient and an outpatient palliative care service. So if you're interested in palliative care, you should have a good opportunity to do that. Quite a number of us still do obstetrics, so we've got a low-risk obstetrical unit doing about 300 low-risk deliveries a year after 36 weeks. So the obstetrical portion is not mandatory, but I encourage people because it's a very different experience. We're actually following our own patients and delivering our own patients, which is a model that you're not seeing as often anymore. So in addition to that, there's other experiences you can look for in our community. A number of my colleagues do nursing home work, and that is an option. We have a family health team, and so we have a number of allied health professionals who are happy to see residents. We have 2 clinical pharmacists, we have 3 social workers, a clinical psychologist, a nurse practitioner, and we have a good relationship with some community-based practitioners like the community-based pharmacist in town, and a community-based palliative care nurse practitioner who will take people out on home visits. So there's a huge variety of things that you can do here. We also have a walk-in clinic, and most of the residents seem to like to do walk-in clinic shifts. It is good for improving your efficiency of seeing patients, and I think most of us want to know that we can earn a living when we finish, so that's another option there. You don't need a car to be in Port Perry. The accommodations are generally nearby, so in most cases you are fine to walk or bike to work. The closest accommodation is right next door to the hospital. Queen's University has an apartment downtown. There's usually a spot available there. It's about 4 blocks walk from here, and it's above a chocolate shop, so it smells fantastic there. There's also a number of other options for accommodation, including one of our OR nurses has a basement suite that's not your usual drab dreary basement. It's a step up from where I live anyway. So lots of options that way, all generally walkable. It's useful to have a car, for things like home visit work and some of the community-based stuff, but we can work around that, so it's not a huge deal otherwise. There is public transit from Port Perry through Go Transit, so Go Bus can take you right down to the Go train, so you can get here by public transit. It's just not as convenient because it's only a few times a day because we're at the very edges of where Go services. We just had a major renovation and so have added a 10,000 square foot addition to our clinic. Very funky architecturally, but really nice inside. It has allowed us to have a procedure room as well, so we do minor procedures, and I do a lot of IUD insertions as a consultative service for my colleagues and for the Sexual Health Center in town. So we've got really good circumstances there. We've been on EMR for the past 10 years. We use Genoki, which is not as common in Ontario. Like all EMRs, it has its advantages and disadvantages, and we can get you running. We have full-time IT service, so we do actually have support who will train you on how to use the EMR. So if you're not familiar with that particular one, or you're not really that comfortable with the EMR, we'll get you up to speed. So what else is there to do in Port Perry? Well, it's a lovely community in terms of outdoors stuff. We're right on a lake, so there's canoeing, kayaking, sailing on the lake, water skiing in summer, ice fishing in winter. We are about 15 minutes away from about 225 kilometers of mountain biking trails. There are 6 ski hills within a half an hour, so if you are a skiing enthusiast, there's lots of cross-country and downhill trails just close by. So basically, if you like to do it outside, you can do it close to Port Perry.